1. You just passed your BCBA exam and now are officially a behavior analyst. You go out with your friends to celebrate. You wake up the next morning and ask your friend how many glasses of wine you had. She told you that you drank probably 3 glasses each hour. What measurement is your friend using? Okay, starting off with an easy question. Probably a 2 or 3 on the difficulty scale, not too difficult. Test is long, it's got a lot of questions. There are going to be some easy ones. Don't overthink the easy ones. Trust your preparation, pick your answer, move on. So in this case, what is the question asking? Let's start there. They're asking about the measurement and specifically the measurement your friend is using. What the test will try to do is throw in a lot of different people, stimuli into the question to confuse you. You always want to narrow down exactly who we're talking about and what we're talking about. So we're talking about measurement your friend is using. Your friend told you you drank probably 3 glasses each hour. So 1, she's counting how many glasses you had, and 2, she's adding a time component to that amount. So if we have a count plus a time component, what do we have? A, frequency. We do have a count, but frequency is missing what? It's missing that time component. B, rate. Rate has a count plus a time component. It's the definition of rate. So perfect. It looks like your friend is telling you the rate of wine you were drinking per hour. It's not duration. We're not looking at the length of a response, not how long it took you to drink or anything like that. And it's not latency. We're not looking from the time between the SD and the first response. We're simply looking at a count, 3, over a time, hour. So our friend or your friend is using the measurement of rate. Clients at an ABA clinic eat lunch in the yoga room. Now, when a client is hungry, he will say yoga room. The client saying yoga room is under the control of what? So what happened in this scenario? We had a client who every time it was time for lunch, someone would say yoga room, or they'd say, let's go to the yoga room. Now the client has associated and paired hunger with yoga room. So they're really doing what? They're manding for food by saying yoga room. Now we need to change that behavior, but that's not neither here nor there, right? We're focused on the question at hand. And the question at hand is asking, saying yoga room is under the control of what? So this is where knowing interverbals, or I should not interverbals, but your verbal operants come into play. Because if our client is manding by saying yoga room, that's what essentially the question is asking. The manding is under the control of what? Is it under the control of an SD? Well, no, it's not, because the yoga room might not be available. Okay, the food might not be available. However, the client is hungry. He is motivated to ask for food. Is it a prompt? It is not a prompt. Remember, we're manding. Is this an interverbal? It's not. Nobody asked the client, where do you want to go? Nobody asked the client if they were hungry. The client simply said yoga room. So that's under the control of an MO. Remember, a mand is evoked by a motivating operation, not a verbal SD. This is why we need our verbal operants, and we need to understand them fully. What evokes them, what reinforces them. Okay, so the client saying yoga room, the client is hungry. The client saying yoga room is under the control of the motivating operation of hunger. Greg gets a job loading luggage at the airport. Greg is supposed to put the luggage into different colored bins. Sometimes Greg will throw the luggage into the bins instead of placing the luggage. Greg needs to work on what? Okay, we're looking at who? We're looking at Greg and what Greg needs to work on or improve upon. What do we know about Greg? We know he loads luggage at the airport. We know he's supposed to put luggage into different colored bins. So be careful, because as soon as you read different colored bins, a lot of people are going to want to say, well, obviously discrimination. But do they ever mention the colored bins again? Do they mention anything about Greg putting luggage into the wrong bins or putting into the wrong color? They don't. So be careful. What they're talking about is Greg throwing the luggage instead of placing the luggage. So are we talking about stimuli here? Or are we talking about responses? We're talking about responses. And so when we're talking about responses instead of stimuli, we're not thinking discrimination. What are we thinking? Well, A, differentiation. Remember our trick. Differentiation is actually called response differentiation, and discrimination is actually stimulus discrimination. Discrimination would be telling the difference between different stimuli, different colored bins. But that isn't Greg's problem. Greg's issue is he can't differentiate between responses. He's throwing when he really should be placing. Greg needs to start differentiating the appropriate time to throw luggage and to place luggage. The bins aren't the issue, it's the responses. Be very careful with these questions that you don't just immediately jump to discrimination, because that's what we more commonly think about, discrimination training. Differentiation is just as important, right? Frustration tolerance, not something we're going to really consider here. We're not going to consider Greg frustrated or mad or bored or irresponsible. None of those things, right? Remember, objective, observable, measurable. And then stimulus control. Greg doesn't need to work on stimulus control. Maybe his boss or his supervisor needs to work on stimulus control, because right now Greg's throwing the luggage is under stimulus control of the bins. They need to change that to where when Greg sees the bins and the luggage, he's placing the luggage, not throwing it. So Greg ultimately needs to work on differentiation. Lindsay's two kids are in the backseat of the car. While driving down the highway, both kids try to read the sign faster than the other. The kids are engaging in what? Okay. Fairly straightforward question. I would say a 3 or 4 difficulty. Trust your preparation. So we're looking at the kids, not Lindsay. What are the kids doing? Well, they're sitting in the backseat of the car and they're trying to read signs. Those are the two apparently responses or behaviors. Okay. Sitting is even questionable. So we're really looking at reading, right? Reading the sign faster than the other. Okay. So this is the Premack principle. Is it? What does the Premack principle say? The Premack principle says you can engage in a more preferred activity or response if you first complete a less preferred. Is Lindsay setting up a contingency here? No. Are there any contingencies in place? No. Therefore, it isn't going to be the Premack principle. B, textual. Is this a textual? A textual is essentially reading, evoked by a nonverbal SD, point-to-point correspondence. Looks good, right? We're trying to read the signs, trying to say exactly what the signs say. What about transcriptions? Transcriptions also are evoked by a verbal SD with point-to-point, but transcriptions, you're essentially writing notes. You're taking notes. You're writing out what you're hearing. Kids aren't writing, they're reading. And then an intraverbal. Intraverbals, they do not have point-to-point correspondence, right? They're evoked by a verbal SD. If the kids are reading the signs exactly, they're looking at point-to-point correspondence, right? And so when the kids are reading the signs, they're just engaging in textuals. Now, if you know what a textual is, pretty straightforward, but you can go deeper, and you should with practice and break down each term in your head. What is it? Why is it wrong? Or why is it right? The more you do that, the more fluent you'll get, and the more fluent you get, the better you get at the exam. A multiple stimulus preference assessment indicates a client's most preferred item are grapes. You conduct a reinforcer assessment and determine that grapes do in fact possess reinforcing properties. You write a behavior plan that calls for providing grapes every 2 minutes to a client if they are sitting in their chair. What describes your reinforcement plan? All right, long, convoluted question. Let's be specific. We are talking about our reinforcement plan. So what is our plan? Well, we've done the preference assessment, identified grapes. We've done the reinforcer assessment and know that grapes do in fact possess reinforcing properties. So it's not an issue. These are reinforcing. Our plan is providing grapes every 2 minutes to a client if they're sitting in their chair. So is it going to be A, non-contingent reinforcement? Well, no, there is a contingency in place. If you sit in your chair, then you get grapes. It's not contingent. It is very much contingent. So our plan calls for every 2 minutes they're engaged in the response. So is that going to be a variable interval, 2 minutes? A variable interval says we deliver on average. It can be changing. This isn't changing. It's saying every 2 minutes consistently deliver the grapes. So we're really looking at a C, fixed interval, 2 minutes. A fixed ratio 2 would be based on a number of responses. So every 2 responses, right, we provide the grapes, but not what we're looking at. We're looking at a time here. Remember, interval means time. So we're looking at a time interval that isn't changing, fixed 2 minutes. So our reinforcement plan is going to be a C, fixed interval, 2 minutes. Yes, you still need to know basic reinforcement schedules for the exam. Which of the following scenarios best describes a private event in applied behavior analysis? All right, private events have to do with radical behaviorism. From Skinner, private events we acknowledge are behaviors. However, we can't observe them, we can't measure them. But we do acknowledge their existence and their impact on the learner or the client. So a private event is something that cannot be observed by an outside entity. No matter what, we can't observe them, okay? Other than maybe you have a specific tool, right? So medically, okay, we can observe stuff inside the body if we have tools, but that's one of the rare exceptions, right? Private events, thoughts, feelings, these kind of things, okay? Which of the following scenarios best describes a private event in applied behavior analysis? A client sitting in their room alone, reading a book out loud. They're alone, but could we observe them reading the book out loud? Yes. So don't get tricked by this common wrong answer for private events. Just because you're alone doesn't make it a private event. A private event is unobservable. B, an employee eating dinner with their bosses as part of a promotion process. Can you observe all of these things? You can. You can observe eating dinner with their bosses. C, a student thinking about a math problem in a full classroom. Well, just because it's a full classroom doesn't mean we can observe the student, quote unquote, thinking. Thinking is considered a private event. And then D, a woman professing her undying love to her boyfriend in a secluded area of a park. Again, the environment has nothing to do with it. Full, empty, alone, not alone, doesn't matter. We're talking about the event itself, the response itself. Reading a book out loud is observable. Eating dinner is observable. Professing undying love is observable. Thinking is not. So be careful with the private event questions, right? Often misunderstood. Okay, so make sure you get that, right? We're not talking about the environment. We're talking about the event or the response itself. So a student thinking about a math problem in a full classroom best describes a private event in applied behavior analysis. After careful consideration, John fires Anna but gives David a raise. When Anna asks John why she was fired and not David, John says the decision was made strictly on each person's results. John is utilizing what? So John is being very what? Because he's just looking at results alone. Maybe John can't stand David, but all he cares about is the outcome. What is working, essentially. So is John using parsimony? Parsimony is the simplest explanation with the least amount of assumptions. We're not sure if this is the simplest explanation. Okay, we're not sure all the other things. Nothing indicates that John is using the simplest explanation first. Okay, maybe the results were very complicated. There's nothing indicating John is being parsimonious here. What about determinism? Determinism says behavior is lawful and orderly, and it happens for a reason. Are we looking at John analyzing behavior here? No. He's just telling Anna this is why it happened based on these results. Okay. Anna might disagree and say, well, this isn't for a reason. Okay. This isn't lawful. This isn't orderly. Nothing indicates determinism here. Pragmatism. Is John being pragmatic? He is. Pragmatism is just saying, let's go with what works. Okay. That's going to be our guiding light. What works, that's what we're going to use. Let's be pragmatic about this. And John is being pragmatic. He's telling Anna it's strictly based on results, not you as a person, not a relationship, nothing else, just what's working, what is not. This is very pragmatic. You can see being pragmatic isn't always easy, isn't always embraced, because you're not taking other things into account sometimes. You're just looking at what works and what doesn't. Now, when you're designing interventions, you should be very pragmatic. All you care about is what works. Ethically, of course, but you want to go with what works. Not what you think or what you want, but only what works. Selectionism, not talking about learning history, not talking about genetics here. Okay. John is simply being pragmatic. This is what works. We're going with this. End of discussion. You're teaching someone how to make toast. You watch as they grab a piece of bread. You then touch their elbows with your hands and guide their arms toward the toaster. As they get closer to the toaster, you quickly remove your hands. What type of prompt are you using? Okay, if you know this type of prompting strategy, probably a 1 or 2 difficulty question. If you don't, still pretty easy, because we know what? Well, we know we're touching their elbows. Physical touch is what? It's a physical prompt. Okay, it could be partial physical. This looks like partial physical. Still a physical prompt. So if we look at A, least to most, we're never going to start a least to most procedure with a physical prompt, right? Physical prompts are the highest of intrusive prompts. B, gestural. Gestural is you demonstrating a portion of the desired behavior or a quick motion to indicate what you want, you're not gesturing, you're actually physically prompting this person. Modeling is engaging in the desired response to show the other person what you want done. So modeling this would be what? Well, you would actually grab the bread and put it in the toaster. You're not doing that. You're physically prompting them by touching their elbows and guiding them. But the key here is what? As you're physically guiding them, and they get closer, you're quickly fading the prompt. You're removing the prompt as quick as possible. And when you physically prompt, but remove as quick as possible, what are you using? You're using graduated guidance. Graduated guidance is a type of physical prompting strategy where we're using just as much physical prompting as necessary and then immediately fading out again. If you know that, fairly easy question, because we know it's a physical prompt. We know we're fading fast, so we know we have to be using a graduated guidance. Not gestures, not models, and it's not least to most. You design a school-based intervention for use in your client's classroom. After 2 days, the teacher reports that she doesn't see any change in the behavior. How would you proceed? All right. What do? We always read all of our answer choices, right? Now, think about this question. How are you going to proceed if we only have 2 data points indicating your intervention doesn't work? Is that enough to indicate something doesn't work? Probably not. Okay. So what should we do here? A, assess the teacher for treatment fidelity and advise to continue treatment. This looks pretty great, right? 1, make sure she's doing it correctly. And 2, let's continue. We only have 2 data points. Do we stop there? Do we pick A and move on? We do not. Read all of our answer choices. B, terminate treatment immediately. Well, 1, you're not even sure if she's doing it right. 2, you only have 2 data points. So unless something horrible is happening due to the intervention, you don't have enough data to really make a decision. C, inform the teacher she is doing the intervention incorrectly and advise to continue treatment. Well, how do you know she's doing the intervention incorrectly? There's no indication you've done an assessment. It's only been going on 2 days, and she's reporting this to you. It's not like you observed this. So C is not as good as A. And then D, advise to continue treatment. Well, we can advise her to continue treatment, but what if she's doing it incorrectly? If the fidelity isn't there, it's not going to be effective. So before we advise to continue, we need to assess that teacher, make sure treatment fidelity is present, and then we can advise to continue treatment. So how would you proceed? Well, you want to assess, make sure everything is right, and then you can advise to continue treatment. A few more data points, and then make